Hey guys, welcome back to Medical Coding with Blue. Today's episode is all about medical coding job listings explained. If you are brand new to my channel, welcome. I am Blue. I'm a medical coder. I have been a medical coder for over 10 years. I really love sharing the things that I know, the tips, the tricks, the lifestyle of being a medical coder with all of you. So I hope you'll take a second, hit that subscribe button, hit the like button, and at the end of this video helps you, I hope that you will share it. Okay, so let's get started. All right. First things first, yes, I do have a secret that I'm going to reveal somewhere in this video. I can't tell you all right away. I want you to watch the video. But it is going to be really helpful, okay? And along the way, I'm also going to be talking about some other tips that I think are also very helpful. But before I get into the job postings, I want to let you guys know that these are from Indeed. Now, I'm not going to give you the link for this specific job because, as you all know, these videos live on in perpetuity. So there's really no point in posting the link. It may not be there when you watch the video anyway. But yes, this is not an ad for Indeed. This just happens to be the search engine for jobs that I am just using for this purpose of talking about these jobs. And I think it's important that to understand the language of these job postings. A lot of times I'll get emails from viewers, well, Blue, what do I need to know to be a medical coder? What are employers looking for? These job postings are telling you exactly what these employers are looking for. So it's important to pay attention to the details of the job descriptions along with the language. What language are they using? Are they saying preferred? Are they saying required? Preferred means that if you have it, okay. If not, if we like you, maybe we'll give you a chance. Required means you absolutely have to have it. Now, there is one caveat to the required. I always say, okay, and this is my own personal opinion. You don't have to listen to me. You don't even have to take my advice, okay? I'm just giving you guys this information because I wish somebody would have told me this stuff when I was looking for a job, okay? When it comes to the required experience, they want 1 year of experience, they want 3 years of experience, they want 5 years required of experience. The only time that you should sort of overlook that required is when it's like a job that you actually physically go to. Yes, right now we are in the middle of a pandemic and there's a lot of remote work going on. So maybe if you're applying at a place where you actually have to physically go, they're going to have you working at home temporarily sometimes, okay? Not at all places, but some places, okay? And if they have you working at home, it's just temporary. Just know that, okay, until we all can get a better handle on this pandemic. But of the simple fact that when you are looking for a job and you're a brand new coder, yes, is it going to be hard for you to find a job in the beginning? Of course. 98% of us have had this issue. Now, the thing is, you have to apply anyway, regardless of whether they are asking you for experience or not. The only time that you're really going to have experience is when you are looking for a remote coding job. Now, if you're looking specifically for a remote coding job and you have no experience, that's going to be different. They're going to tell you no a lot. And a lot of people don't like it when I say that, but I want you guys to be aware and I want you guys to know that this is actually what happens. Are they still hiring for coders right now? Yes, we are in the middle of a pandemic, and this pandemic requires medical information. It requires statistics, okay? I was trying to get hung up on that word. Okay, it's requiring statistics. And so in order for them to get those statistics, they need qualified people to overlook this documentation and make sure these are coded properly, okay? This is when medical coding comes into play. So, are they still hiring during this pandemic? Absolutely. I was able to look on Indeed and find all of these job postings. Now, I went to different states. I looked in Illinois, Michigan, Texas, and Florida for these jobs, okay? And so they're everywhere, okay? So they're always going to be hiring. So don't let it discourage you. Still apply anyway, okay? Always take proper safety precautions. Use your mask. Wash your hands, that kind of thing. Stay 6 feet apart. And I'm going to go ahead and get into these right now, okay? All right, the first one is medical billing and coding specialist. Responsibilities for this position include, but are not limited to, Ensure all services performed by the practice are accurately coded and billed to the appropriate payer and in a prompt manner. Investigate and resubmit and or appeal denied and rejected claims. Post payments and adjustments promptly and accurately. Prepare and send patient statements on a routine basis. Handle patient inquiries regarding statements, payments, claims, insurance coverage, and all other financial and insurance-related matters. Monitor and reduce accounts receivable by correcting and resubmitting claims in a timely manner. Education and experience, high school diploma or a GED, 2 years billing and coding experience in a medical office setting. Formal billing / training / certification is a plus. Experience with electronic medical record systems, prior experience with clinical e-works is not required, but it is a plus. This is a full-time job. Benefits is 401k and 401k matching, paid time off, health insurance. Schedule is Monday through Friday. COVID-19 considerations. Masks are required in the office when interacting with others. All employees submit to a daily health screening questionnaire and temperature reading. Experience medical coding 2 years is required. Again, I would still apply anyway if you're a brand new coder, okay? Education, high school or GED, and then it says work location on location, okay? Again, when you are looking at these job postings, that is the one thing that I tell you guys to overlook if you have to physically go somewhere, is the time experience required, okay? Just go ahead and apply anyway. And look at everything that you are being asked of. Is if you have any of these skills, and you need to put them on your resume. When you were in school, if you happen to go to a school or a trade school or an online program and you used like a 3M encoder, you need to put that on your skill set, okay? Because the simple fact is you have experience using an encoder, okay? That's one of those things that you can add. That's one little secret, but it's not the main secret. That's coming up shortly, okay? Next job listing. Medical biller and coder. We are looking for a medical biller / coder to assume the responsibility of all billing needs. Now, I'm going to stop right here. If you are a medical coder, it does not mean you have to be a biller. Some places, like this place here, they're asking for the person to have the idea of both the billing side and the coding side. Sometimes in smaller places, smaller offices, smaller hospitals, they will have their staff do that, have the dual responsibilities. So always when you're looking in these job postings, if you don't want to do billing, then, move on to the next job posting. But just keep that in mind. Some places will have you only doing the coding. I only do the coding. Anything that I understand about billing is because I've taught myself. I'm a researcher by nature, and I'm always going to push myself to learn, because the more you learn and the more you try to go out of your way to learn, the better off you'll be. So I'm just putting that out there real quick before I continue on. Now, next. Responsibilities include perform specialized medical billing and claims resolution, organize, update, and continuously proof data entry, follow up on unpaid claims within standard billing cycle timeframes, post payments in electronic health records, submit appeals for denied claims. Applicants must have a strong work ethic, be diligent in their duties, timely, and a team player. Must have knowledge of insurance, credentialing, and accounts receivables, CPT and ICD-10 codes, medical terminology, and Epic is a plus. Job type is full-time. Schedule is Monday through Friday. Experience medical coding 3 years. Preferred. Not required. Preferred. See, that's the language part right there. And high school education, a high school diploma or a GED. Okay. And remote workly, no. Okay. It said absolutely not on that one. All right. Now, next one. Certified biller and coder, responsible for billing and or coding for physician practices to ensure proper collection of services rendered for maximum cash flow while improving patient, physician, and other customer relations. Okay. Position hours, 32 hours a week, days. Education, high school degree, high school diploma or GED, although they said high school degree. Associates in health management or business administration is preferred. Again, preferred, not required. Okay. Registry slash certification, medical insurance certificate, and coding certification, CPC required or must be eligible to sit and pass certification within 6 months. When you say that, okay, and you are still in school and you're going to try to go ahead and start getting your resume out there and things like that, if you are majority done with your school and you're going to be sitting for your certification exam pretty soon, go ahead and apply. It never hurts to go ahead and start getting out there, all right? Now, that's just a suggestion. It's not something that you have to do. If you want to get done with the school first, that's totally fine. But I'm just saying that if you are about to take your certification, they're saying that that's okay with them, okay? As long as you're, about to take it, you have to have it within 6 months, okay? And even though they just said CPC, I'm sure that they would consider you if you were an AHIMA member as well, okay? Sometimes when they say like CPC or whatever, it's because the other people in the office have that same credential. A lot of times if they don't understand or they don't know about multiple credentials or multiple associations, like the other association, which is AHIMA, if they don't know, then they're going to go with what is familiar to them. It doesn't necessarily mean that one is better than the other one, okay? I just want you guys to know that sometimes people are going to have what is most familiar around them. So that's why they may say, oh, CPC, if you have a CPC, that would be great, But it doesn't mean that if you have an AHIMA credential that you can't still apply to, okay? Now, the next one, it says experience 1 year coding / medical insurance billing experience for family practice office, surgical, orthopedic, and multiple specialty practices is a plus. Requirements, proficient in medical terminology, like I always say, ICD-9 and or CPT. Now, you may see ICD-9. Obviously, ICD-9 is no longer, okay? We are not even coding with that system anymore. But this is sometimes when people don't really quite know what they're looking for, or maybe somebody in HR is writing this job description, they don't necessarily know the specifics about medical coding. So if you see ICD-9, ignore it. You're trained in ICD-10. Everybody's in ICD-10. Just keep going, okay? Because nobody uses ICD-9 anymore, okay? So don't worry about that. Possess strong analytical skills, knowledge of professional as well as ASC billing and coding, ambulatory surgical center billing and coding, okay? Demonstrate proficiency in computer skills, knowledge of computerized billing systems, demonstrated ability to communicate effectively, both verbally and in writing, with internal and external customers, possess strong skills with respect to interpersonal relationships, workspace organization, and problem solving and analysis. Now, the secret that I want to reveal with all of you, that I was so excited that I found out the other day, and I wanted to tell you guys, but then what treat would I have for this video? Guys, you know how a lot of times they're telling us, oh, you need experience or you need to know about Epic, or the one that I said earlier, which was what? eClinical Services. What was that program? Yeah, eClinical Works. There's other ones, other electronic health record, right? And you're like, how do I know? How do I get any experience with that if if I've never worked with it before? Are you ready? You can go on YouTube, Google the name of that particular electronic health record. Boom. You've got tutorials popping up left and right, left and right, left and right. So you can go through these and look at look and see how the system works and get an idea and get familiar. So then you can put that on your resume that you have been doing your research. You may be brand new. You can even put it on your cover letter that even though you are brand new, you've been doing your research and you've learned the ins and outs of the Epic system or Alta or eClinicalWorks, whatever. Look online on YouTube, and there's plenty of tutorial videos, and at least give you the broad strokes of learning that particular electronic health record system or electronic medical record system. So how exciting is that? Now that's another skill set that you can put on your resume. Okay, it's not that you're lying if you're looking at the video, the tutorial video, but you can even put that on your cover letter that you've watched the tutorial video for Epic and you are ready. You want to do this, or you've watched the tutorial video for eClinicalWorks and you are ready to do this. You have been doing your research on CMS, so you are understanding the rules and the guidelines for Medicare and Medicaid. You've looked at the websites for Aetna, for Blue Cross Blue Shield, and things like that. Get yourself familiar with what the industry wants, which is knowledge of these electronic health records or knowledge of these insurance companies. This is something that you can proactively do while you are looking for a job. And yes, there's going to be a learning curve when you get on, but wouldn't you rather be a step ahead? And being a step ahead by watching these videos on YouTube, I mean, how awesome is that? And I cannot believe that I didn't even think of that before. But I mean, it's true. If you're going to be looking and you're going to want to expand your skill set, at least watch those tutorial videos. Put it on your cover letter that you've been watching these tutorial videos and that you are very excited, you're very engaged, and you are ready. Okay, and see what your response to that is. Guys, it's going to take you to be very proactive when it comes to finding a job, especially as a brand new medical coder. And trust me, I know it gets aggravating and it gets so discouraging to be told no, to be told no, to be told no. I was told no for 2 straight months and I was so tired of it. I was so tired of it. And it wasn't until I went to a temporary agency that I was able to find my first job. But had I known about all this stuff back then, maybe I would have found a job a lot sooner, because then I would have known. At least now you guys get the benefit of what I've been through, my experiences, that I'm sharing it with you guys. So that way, when it is your turn to get out there and really start looking, then you'll be able to know, okay, well, it might say this, but that's okay, because I can use that to my advantage. I know what the employer is looking for. I know what skill set they want. So let me go ahead and study, and let me go ahead and look and do all my research so I can find out what it is that this company needs, or this business needs. Okay, and they do train you most of the time when you are starting on the job. If you have no experience with that particular electronic health record, they usually do give you a class when you get there. But at least if you already have an idea, it's just going to make what they say make a lot more sense. Okay, so that was my big secret that I've been sitting on this whole time. And I've been so excited to share it with you guys, because like I said, I really wish I would have known that, because I've been thinking, oh, like, gosh, I don't know anything about Epic. I don't work with Epic at my facility. So it's just like, any Cerner even has a tutorial video on there as well. So Cerner, Epic, all these big, huge electronic health record systems are all online. So take the time and do your research and find them and look at them and just watch them. Okay, so it's only going to benefit you, because then that's even more that you're going to get put on there that you have knowledge of. Okay, you don't have work experience yet, but you do have knowledge. And like I said, if you have experience working with an encoder, put whatever encoder name that you had working there. So at least that way they know, okay, they're familiar with how an encoder works. Okay, next one before I keep going on that. All right. Okay, so I read that one. Okay, now I've gotten emails before from CNAs, certified nursing assistants, and that they want to make the transition into medical coding. So here's a position that I found. It's a medical records coordinator, okay? And it's a full-time position with competitive wages and excellent benefit package. Duties: organizes, plans, and directs the medical records section in accordance with established policies and procedures. Maintains the highest level of confidentiality in accordance with HIPAA regulations. Maintains minutes of meetings and files as necessary. Develop and maintain good working rapport with interdepartmental personnel. And assists with recording all incidents/accidents, files documents in accordance with established procedures and policies, collects, assembles, and checks the files residence charts and personnel records as required, establishes procedures to ensure that all records are complete and correct, and returns records to the nursing services for any necessary corrections. So this is calling for somebody who's very detail oriented, okay, and knows what to look for, all right? But qualifications, get this: high school diploma or a GED, and previous long-term care assistant experience is preferred, all right? Successfully completes facility conducted orientation, mandatory training, and in-service programs. Must be capable of performing the essential functions of a job with or without reasonable accommodation. Must be able to communicate in English both verbally and in writing, and possess sufficient communication skills to perform the tasks required. And then the benefits is 401k, dental, disability, employee assistance, employee discount, health insurance, vision. Experience CNA 1 year is preferred. So there are positions out there if you're looking to get into that transition. Yes, this position did not specifically talk about medical coding, but it did talk about looking at that detail and looking to see if there's anything that's missing, okay? So that is really actively taking part in the reviewing process, which is another point on your resume, okay, that you've had experience doing that, right? If you want to apply for this job, and this job is paying pretty well, okay, for what they're asking for versus what they're paying. This job is paying very well. So high school diploma or a GED in English is required, okay? So if English is not your first language, I will say this, please work on if you have a thick accent, please work on your accent, and please work on your grammar and because when you are doing positions like these and you have to do emails and things like that, your grammar needs to look good, your spelling needs to look good. And with all of the software that we have for spelling errors should never occur anymore, because of the simple fact that it will tell you if the word is spelled wrong. And to me, when I see if words are misspelled and things like that, or there's not really good sentence structure and things like that, there's no excuse for it, considering the fact that we have these software systems that can help us to write out really good sentences. So again, please work on those things. It's only a benefit to you. It's only going to make you more valuable whenever you are working, because the thing is, then you'll be able to clearly communicate with everyone, and there's not going to be that disconnect, okay? Because sometimes people feel disconnected from others when they feel like they can't understand. If the person has a really thick accent, and I know some people, they just can't help it, but we can work on these things. If actors can change their voice from sounding like very one way and then sounding like a very other different way, it is possible, okay? So just consider that. I'm just saying, okay? And then another one, because we have a few more minutes. Okay, coder in the hospital. Primary responsibilities for technical coding include the assignment of ICD-10-CM/PCS, CPT and HCPCS codes, modifiers, selection of MS-DRG, diagnosis-related groupings, okay, APC, ambulatory payment classification, and coding for severity of illnesses. Primary responsibilities for Profee coding. Now, Profee, if you don't know, is the professional side. So it is basically inpatient, but it's outpatient. So an outpatient provider will go up to like an inpatient floor. All right. This is the easiest way I can explain it. The patient is inpatient, right? And a outside service, the provider, right, from the outpatient setting comes in, right, and he sees the patient as a consult, or he's part of the team that is taking care of this inpatient, but he goes back to his clinic, all right, or she, and they're taking care of this patient. Well, the inpatient side of the house is already being taken care of by the inpatient coders. So for this provider and their services for going there and taking care of this patient, that is what is called the Profee, or professional services, okay? And so then that's when, you would have those separate evaluation and management codes, okay? And then you would be able to code basically outpatient, but in an inpatient setting, okay? You're not going to follow the inpatient rules. You're only going to follow the outpatient rules, okay? And if you're curious, I do have a video on Profee coding, all right? So, but Profee coding includes the assignments of ICD-10, CPT-4. CPT-4 just means the current procedural terminology, 4th edition. Okay, it's not anything different. It's just the 4th edition, all right, which we are all using. And HCPCS codes, modifiers, and evaluation and management codes for ED and provider audits. Interacts with medical staff, nursing and ancillary departments, provider offices, and outside organizations. This is the medical records management department. The hours are from 8 a.m. to 4:30 p.m. Education is a high school diploma or a GED. The minimum required credentials, okay? You have to have a CCA, which is a Certified Coding Associate, CCSP, or a CPC, all right? So there you go. And then the last one, I'm almost out of time. Outpatient Certified Coder on-site. This is accountable for conversion of diagnoses and procedures into codes using the ICD-10 code set. CCA, RHIA, RHIT, or CCS is required. 2 or more years of experience previously in a hospital as a coder is preferred, not required. Required skills is the sequencing of diagnosis and procedures to optimize reimbursement, ensures that records are accurately coded in a timely manner, and able to work with physicians in a collaborative approach for specificity. There you go. So I hope you've enjoyed this episode. I hope you'll consider supporting me on Patreon as well. I will leave that link down in the description box below. I do have unofficial coding exercises where I do talk about my rationale, and we do other fun things over there on my Patreon channel. So I'm going to wrap this one up. So if you are a medical coder, a medical coding student, somebody curious about the fascinating world of medical coding, a provider, or a nurse, I invite you to like and subscribe and follow me on my journey in medical coding. I will see y'all next time. Bye.